Cheeky. Are you going to work it for the camera? Go on. Go on. Yeah.
I was 38 years old when I had to access IVF, as it was my only option to conceive another child. Unfortunately, I was diagnosed with stage 4 endometriosis. I longed for a child. I longed for more children. But unfortunately, it just wasn't the case or scenario this time around. I've known couples that have put their whole life savings into IVF. That was out of reach for my husband and I, because we were trying to have the Australian dream of building a first family home, that we couldn't have it all, unfortunately. So it meant the world to be able to have Bonnie join our family. Yeah. So we're very, very lucky and fortunate that we had this service available. I think it was meant to be.
Trying to fall pregnant and starting a family is an incredibly emotional time. It's a big decision for people to make. And then to finally sort of make that decision, yes, I'm going to have a child. And then for that not to happen, huge emotional roller coaster. Public fertility care is for any Victorian looking to start a family who are struggling or taking a while to fall pregnant. You just have to be a Victorian resident with a Medicare card, and you need to have seen your GP to get a referral and some sort of basic investigations before you come and see us in the clinic.
My initial consultations were done at Bendigo Health. It was very simple. It was just a few more tests that needed to be done to tick the boxes, and then anything that was more involved, like egg retrievals and transfers and ultrasounds, were done at the Royal Women's. I had a real positive experience at Bendigo Health Public Fertility Clinic. I felt a sense of country care as soon as I walked through the doors, and the nurse and doctors were very nurturing and caring, so I knew I was in really good hands.
The role of the public fertility is to be able to sort of allow anyone and everyone to come and get access to high quality care to help them start a family.
I didn't have many out-of-pocket costs. From memory, I think it was with the 2 rounds, the medication came to about $300 in total. I don't think there should be a price put on having a child. It was all very, very cost effective. Anyone looking to access public fertility care should just go for it. Don't wait. I found the care second to none. The proof is in the pudding. 2 rounds from the date of the referral to when I got the positive after 11 years of trying was 5 months. If the service wasn't available, I wouldn't have been able to pursue IVF at all, and that dream of wanting to add to the family wouldn't have been possible.
For those people who do want to start a family and it's maybe not going as they expect, the ability to be able to say this can be an option for you is really important. That's where the public fertility really comes into it. It means that I can look them in the eye and say, look, this isn't the end of your journey. And that's a really, really lovely part of the job.